You're watching Cetome TV. Knowledge is power.
I'm going to talk about an amazing new field now, and there's a lot of amazing new fields in cancer treatment. This is something called Theranostics. And so if you recall, we'll go back to when we discussed the PSMA PET. So just a little primer on that again, in case you forgot. PSMA is a prostate-specific membrane antigen. It's that antigen, and an antigen is referred to as an antibody generator. In other words, an antigen is something that creates an antibody in the body. So in this particular case, this is something on prostate cells, and it's so the immune system could recognize them as prostate cells and make sure they are where they're supposed to be. So when these scientists are developing these PSMA binding molecules, one of the things they found that was really interesting, and I would like to say that a lot of the PSMA technology has been developed in Canada in universities. Unfortunately, Health Canada still is not approving it for treatment. Australia has been using it for many years. Germany's been using it. They've been a hotbed of Theranostics technology. And now you can actually go to India and get PSMA treatments now. So it's being used all over the world now. So PSMA PET, once again, it's a small molecule bound to a radioactive isotope. They inject it into you. This small PSMA seeking molecule will bind onto any prostate cell, and then it will glow when you put it under a CT scan. So some of these brilliant scientists that were doing this noticed that after this PSMA scan, some of the patients actually had smaller tumors. And they thought, okay, what's going on here? Is the radiation from the scan that's targeted to these cells, is it actually killing the cells? And yes, it actually was. So they thought, wow, we can actually do targeted radiation. And so then the field of Theranostics was then born. So if you can go on to the next scan, Michelle.
Well, hang on.
So briefly, Theranostics uses this PSMA binding molecule, although they're developing other molecules for different types of cancers now. It attaches to the prostate cell anywhere in the body. And then what it does is it delivers its radiation payload. So the radiation they use now for Theranostics is a certain type. They're called beta and also alpha emitters. And these are specific radioactive isotopes that are very strong. They're very powerful. However, they can only travel very short distances. So they can't penetrate skin. They can't penetrate bones or organs or anything. They can only penetrate they can only travel a very small area. And because of this property, this is what the Russian assassins have been using, to poison their dissidents and different spies. And the reason they use these radioactive isotopes is because they can handle them. They can carry them around in their hand with no risk. They're not going to set off a radiation detector at an airport, but when they put it in the coffee or a drink or something that's ingested, then it goes in and gets transported through the body, and it kills the person from the inside out, because this radiation can travel a very small distance. So if it's in your blood, it can bind onto the blood cells and kill all the blood cells and get transported into your organs and kills all your organs. So with Theranostics, what they do is they attach it to the PSMA molecule, so it only attaches to the prostate cancer. And so it's a targeted radiotherapy, and it's an amazing tool. So if you can go to the next slide. So one of them is called lutetium-177. It's a beta emitter, and it's attached to this PSMA targeting molecule. And so most of the studies have been in very, very late stage patients with tumors all over their bodies. And, we've used it quite a few times. We've had, many patients get lutetium-177, and we've even had a patient get actinium-225. So another radioactive, there's a whole bunch of different isotopes now. So I'm just giving you two examples. They work incredibly well in late stage cancers, and they will eradicate all of the tumors in your body very quickly. Tumors do come back, but you can get repeat treatments of this because it's not damaging your organs. It's not like standard radiotherapy where you're blasting a beam of heavy duty radiation through your body. It's getting delivered to the prostate cells in a very small dose, and it doesn't affect other organs. So another one is using a new radioisotope called actinium-225. This is an alpha emitter. The benefits of the alpha emitters is that they do have a shorter range, and they have reduced side effects. But importantly, you can use the alpha emitters after the beta emitters stop working. So you can use the beta emitters for a while, and then if they stop working, you can go to the alpha emitters. Another direction of Theranostics combines chemotherapy with PSMA targeting molecules. And these are called conjugate drugs now. So there's all kinds of conjugate drugs for different cancers. So, we're seeing a boom of different targeted chemotherapy. So that's what we call this, as targeted chemotherapy. So one classic example of this is docetaxel is a drug that they normally give you for prostate cancer, late stage. The problem is it kills all of the cells in your body as it's in there. And to give it in a really high level is going to be very toxic for the body. So with Bind 014, it's docetaxel particles that bind specifically to the PSMA molecules on your prostate cancer. So it's targeted chemotherapy. And so this is another form of Theranostics. So amazing technologies here, and there's many new technologies. I could talk for days about the different new conjugate drug technologies for different cancers.
Thank you for watching Cetome TV. Subscribe below and stay informed.